for joining me today. Our presentation is titled Youth and Addiction, Understanding the Addressing the Crisis. I'm Dr. Sindu Padmanabhan. Today, we will explore the complex issue of addiction among youth, its causes, impacts, and effective strategies for intervention and prevention. Let's get started. To begin, let's define addiction. Addiction is a chronic disease characterized by compulsive substance use despite harmful consequences. The scope of this problem is vast. For instance, in 2023, the National Survey on Drug Use and Health reported that over 20 million people aged 12 and older in the US suffer from substance use disorders. Additionally, behavioral addictions such as gaming and social media use are on the rise among youth globally. A 2023 report from the Common Sense Media found that teens spend an average of over 7 hours a day on screens, excluding schoolwork. Understanding these statistics is crucial as we dive deeper into the topic. Youth are affected by both substance and behavioral addictions. For example, nearly 30% of high school seniors in the US reported binge drinking in 2023, according to the Monitoring the Future survey. Prescription drug misuse is another significant issue, with many teens using medications like opioids for non-medical purposes. In terms of behavioral addictions, consider the example of South Korea, where gaming addiction is so severe that the government has established rehabilitation centers specifically for gaming. A recent case in 2023 involved a 17-year-old who collapsed after a 20-hour gaming session. Social media addiction is also prevalent, with the 2023 Pew Research Center survey indicating that 45% of teens feel overwhelmed by social media. Gambling addiction is another concern, with many teens participating in online gambling. Recognizing these various forms of addiction helps us identify and address them effectively. Addiction among youth is influenced by several factors. Biologically, genetics play a significant role. For example, a 2023 study from the University of Cambridge found that children with a family history of addiction are 8 times more likely to develop an addiction themselves. Psychologically, mental health issues often co-occur with substance abuse. The National Institute on Drug Abuse reports that around 60% of adolescents in community-based substance use disorder treatment programs also meet criteria for another mental illness. Socially, peer pressure is a powerful factor. A 2023 survey by the National Center on Addiction and Substance Abuse found that 75% of teenagers reported that they were more likely to drink or use drugs if they had friends who did. Understanding these factors helps in crafting targeted prevention strategies. The causes of drug abuse and addiction include some of the following shown in the slide: poverty, unemployment, breakups, low self-esteem, relationship issues, curiosity. Trauma, peer pressure, parental negligence, and mental health factors. The impact of addiction on youth. Addiction has profound impacts on youth. Physically, it can lead to issues like respiratory problems and liver damage. For instance, long-term alcohol use can cause liver disease, a serious health concern. Mentally, addiction increases the risk of anxiety, depression, and even suicide. According to the Center for Disease Control and Prevention, youth with substance use disorders are twice as likely to have a mood disorder. Academically, addiction often results in poor performance and decreased school attendance. For example, the National Center for Education Statistics found that students who use substances are more likely to drop out of school. Socially, addiction strains relationships with families and peers. Long-term consequences include diminished career opportunities and increased likelihood of engaging in criminal activities. Addressing these impacts is crucial for effective intervention. Effects of drug use. Brain damage, lung infection, kidney failure, liver diseases and heart attack, suicide, crime, and accidents. The signs and symptoms of addiction. Identifying addiction early is key to intervention. Behavioral changes include increased secrecy and noticeable decline in academic performance. For example, a student who was once engaged and active in school may begin skipping classes and failing exams. Physically, look for signs like sudden weight loss or gain and changes in sleep patterns. A teenager who is addicted to substances may experience drastic weight changes or unusual sleeping habits. Emotionally, addiction can manifest as mood swings, irritability, or persistent anxiety and depression. A normally calm and collected individual may become easily agitated or withdrawn. Recognizing these signs allows us to provide timely support and intervention. Routes for drug administrations: oral route, sublingual, which is under the tongue, intravenous, through the vein, intramuscular, in a muscle, subcutaneous, which is under the skin, and the nasal route. Psychological withdrawals. These are some of the psychological withdrawals for the drugs: anxiety, confusion, depression, guilt feelings, nightmares, irritability, delusions, mood swings, hallucinations, drug craving, worthlessness, poor concentration, and low-tempered. Prevention strategies. Effective prevention strategies are essential in combating youth addiction. Education programs in schools like the GAB program help raise awareness about the dangers of substance abuse. Studies have shown that students who participate in such programs are less likely to engage in risky behaviors. Parental involvement is crucial. Open communication and setting clear rules can prevent substance use. For example, parents who regularly discuss the risks of drugs with their children reduce the likelihood of their children using substances by 50%. Schools should offer counseling services for early intervention. Programs like Too Good for Drugs have shown significant reductions in substance use among students. Community programs provide additional support and engagement opportunities, such as the Boys and Girls Clubs of America, which offer after-school activities that keep teens engaged and away from risky behaviors. These strategies collectively work to reduce the risk of addiction among youth. The role of family support in prevention of drug abuse, which includes model good behavior, know their friends, create positive environment, and monitor their activities. Treatment and support. Once addiction is identified, treatment and support are vital. Counseling and therapy, such as cognitive behavioral therapy, are effective in addressing substance use. For instance, the adolescent community reinforcement approach has shown positive outcomes in reducing substance use among teens. Medication-assisted treatments like buprenorphine for opioid addiction offer medical support. The success of programs like the one run by the Hazelden Betty Ford Foundation, which combines medication with therapy, highlights the effectiveness of this approach. Support systems include family involvement and peer support groups like Ally Team, which provide a supportive environment for young people affected by someone else's drinking. Rehabilitation programs, including residential treatment centers like the ones operated by the Phoenix House, provide comprehensive care. Utilizing these resources helps youth on their path to recovery. Role of technology in addressing youth addiction. Technology plays a significant role in managing addiction. AI therapy apps such as WooBet offer real-time mental health support through AI interactions. WooBot uses cognitive behavioral techniques to help users manage their emotions and behaviors. Online counseling platforms like BetterHelp provides remote therapy sessions, making it easier for youth to access mental health services. Monitoring tools and apps track substance use patterns and provide feedback, like the Reset-O app, which is FDA approved for treating opioid use disorder. Online support communities offer peer support and resources, such as the subreddit or Stop Smoking, where users share their journeys and support each other in quitting and smoking. These technological solutions enhance accessibility and support for those struggling with addiction. Case studies. Let's look at some successful case studies. In Iceland, the country implemented a comprehensive prevention program that significantly reduced substance use among youth through after-school programs and parental involvement. The results were remarkable, with the percentage of 15 and 16-year-olds who had been drunk in the previous month dropping from 42% in 1998 to 5% in 2016. In California, a youth rehabilitation center called Thunder Road has achieved high success rates with a holistic treatment approach that includes therapy, education, and family involvement. Personal stories of recovery also highlight the impact of effective intervention and support. For example, Demi Lovato, a well-known singer, has openly shared the journey of overcoming addiction and now advocates for mental health awareness. These examples demonstrate practical and successful approaches to tackling youth addiction. Challenges and barriers. Despite our efforts, there are challenges and barriers. Stigma and discrimination often prevent youth from seeking help. For example, a study published in the Journal of Substance Abuse Treatment found that many adolescents do not seek treatment because of the stigma associated with addiction. Access to resources can be limited, especially in rural areas. A report by the National Rural Health Association highlights the lack of mental health services in rural communities. Policy and funding consistencies can hinder effective program implementation. For instance, budget cuts have led to the closure of many youth support programs. Addressing these barriers is crucial for improving access to treatment and support for those in need. Global perspective. Addiction affects you differently around the world. For instance, Europe has higher rates of alcohol use compared to Asia. A study by the European Monitoring Center for Drugs and Drug Addiction found that 79% of European students had consumed alcohol by the age of 15. International corporations and initiatives like those by the World Health Organization aim to address these issues on a global scale. The World Health Organization's global strategy to reduce the harmful use of alcohol is one such initiative. Successful programs in various countries provide valuable insights and best practices. For example, Australia's Good Sports program, which partners with community sports clubs to promote healthy behaviors, has been effective in reducing alcohol misuse. Understanding these global perspectives helps in developing comprehensive and adaptable solutions. Call to action. To effectively combat youth addiction, we need comprehensive policies that address prevention, treatment, and recovery. Advocacy for policies that support mental health education and substance abuse prevention is crucial. Collaboration among schools, families, healthcare providers, and policymakers is essential. For example, the Community Anti-Drug Coalitions of America mobilizes coalitions to create safe and drug-free communities. Community involvement is also crucial. Mobilizing local resources can make a significant impact. Initiatives like the National Night Out in the US bring communities together to promote drug-free environments. Let's work together to create effective strategies and support systems for our youth. Conclusion. In conclusion, we have explored the types, causes, impacts, and solutions related to youth addiction. Early intervention and continuous support are vital in addressing this issue. The examples and strategies we discussed highlight the importance of a collaborative approach. I encourage you to use this information to enhance your approach to prevention and treatment. Thank you.